Moving along, we'll now have our next speaker of the day, and that is Dr. Daniel Lucey. He's the adjunct professor of microbiology and immunology at Georgetown University Medical Center and an expert on global viruses outbreak. Dr. Daniel Lucey is a physician who's completed his training in infectious diseases and public health at Harvard University hospitals and schools of public health. If any of you know, Georgetown University and Harvard are completely Ivy League, amazing universities in the United States. He worked at the National Institutes of Health in the U.S. Public Health Service as a consultant physician. Especially with SARS in 2003, he traveled to Asia and worked in the SARS hospital in Canada to gain firsthand experience with new viral disease. Similarly, from 2004 to 2012, he traveled to Asia and Egypt to better understand bird flu viruses. Presently, for the last 6 weeks, he has been in the Middle Eastern region to exchange info about the new coronavirus. He's here today to speak about treating chemical, radioactive, nuclear, biological trauma. Ladies and gentlemen, Dr. Daniel Lucey, welcome.
Major General, professional colleague, ladies and gentlemen, thank you very much for the opportunity to speak for the next 20 minutes at this forum in Abu Dhabi today. What I'd like to speak about is a little bit of a different topic, that is a new virus called the novel new coronavirus here in the Middle East, so far found in 4 countries: Jordan, Kingdom of Saudi Arabia, Qatar, and United Arab Emirates. As of May 15th, the disease or illness that this virus causes has been named the Middle East Respiratory Syndrome, or MERS, abbreviated. Before I start on my next slide, I would like to read a brief quote from yesterday's closing of the World Health Assembly in Geneva, Switzerland. It's a quote by the Director General of the World Health Organization, Dr. Margaret Chan. She stated that in looking at the overall world health situation, my greatest concern right now is the novel coronavirus. She further stated, and I quote, "We do not know where the virus hides in nature. We do not know how people are getting infected. Until we answer these questions, we are empty-handed when it comes to prevention," end quote. Again, this is from the Director General of the World Health Organization in Geneva, Switzerland, Dr. Margaret Chan. That said, the good news is that there's no cause for alarm. There's been relatively few people with laboratory-confirmed infection with this new virus. That is a total of 44, 3/4 of whom have been in the KSA. This is over the past 13 months since the first documented outbreak of this virus occurred. Also good news, in my opinion, at this time, is that we can now prepare much better for possible future outbreaks of this virus, potentially, possibly on a larger scale. But we're not at all able to predict with certainty what this virus will do, including whether, in fact, it will cause any large outbreaks in the future. So there's certainly no cause for alarm today. But I think it would be very prudent of us, not only in the medical community, but in all of society, to anticipate what this virus might do in the near future or in the distant future, and to prepare together accordingly. So let me just move through the next 15 slides in the next 20 minutes, starting off with definitions. What is the novel coronavirus? Well, it's a new virus. It is contagious, although in a very mild manner from person to person. It belongs to a family of viruses called the coronaviruses. Why that matters most is because there's a distant related coronavirus, I would say a cousin, not a brother or sister, but a cousin of this novel coronavirus called the SARS coronavirus that you probably all remember from 10 years ago in 2003 that caused outbreaks in a total of 29 countries, mostly in Asia, but a large outbreak in Toronto, Canada also. And SARS, of course, stands for Severe Acute Respiratory Syndrome, similar to the Middle East Respiratory Syndrome, or MERS, M-E-R-S. So briefly, I'd just like to show some maps of where the patients have been found with this novel coronavirus called the Middle East Respiratory Syndrome causing virus, MERS. So the initial outbreak was 13 months ago in a hospital, intensive care and coordinated care unit in a hospital in Zarqa, Jordan, north of Amman. At the time, the virus hadn't been discovered, and so it wasn't recognized what it was. But very good public health and medical response was able to stop the spread of the virus in that hospital. And there's been no further patients in Jordan with this virus that have been diagnosed in the last 13 months. So that's good news. Last June, there was a patient in the Kingdom of Saudi Arabia in the southwest in the city of Bisha, you can see on this map, B-I-S-H-A, who in June became very ill with a pneumonia. This is a virus that affects the lungs primarily, sometimes the kidneys. And he was hospitalized and later transferred to a hospital in Jeddah. But where he became ill was where he lived, which is in Bisha. A very good microbiologist there was able to isolate a new virus, or an unidentified virus, from the lungs, from the sputum of the patient. And subsequently, that was identified as being this novel coronavirus. That was in June of last year, and the first report appeared about this new virus's identification in September on the Program for Monitoring Emerging Diseases website, so-called ProMed Mail website, September 20th of 2012, so not even 1 year ago. Subsequently, a total of 2 patients have been linked with Qatar, with Doha. The 2 patients were subsequently transferred for medical care, one to London in the UK and one to Essen, Germany. And both those patients are still alive today, fortunately. In addition, the majority of the 44 patients, 32 total, have been diagnosed in the Kingdom of Saudi Arabia. And on this map, you can see multiple locations, Bisha, Riyadh, central province called Al-Qasim, and then most recently you've probably seen in the newspapers and on the news that there's been an outbreak of more than 20 patients or 20 people in a hospital in the eastern province in Al-Hafuf in Saudi Arabia. The Kingdom of Saudi Arabia has the Ministry of Health website that I go to each day now, along with that of the World Health Organization and the ProMed Mail, to find updated information, the latest information about this virus. This is actually a little bit out of date now. It's up to 32 patients in KSA, 18 of whom unfortunately have passed away. Again, the first patient appeared in Zarqa in Jordan in a hospital outbreak. 2 people died there, including 1 senior nurse. This was 13 months ago. And then the patient in Saudi Arabia in Bisha in the southwest, who was transferred to a hospital in Jeddah in June of last year, 2012. And then the first patient last September identified in Doha in Qatar, who was transferred for continued medical care to a hospital, a special lung hospital in the UK. And subsequently, outbreaks elsewhere in Saudi Arabia, including in Riyadh, in Al-Qasim. There's also a patient this year from Abu Dhabi who was transferred to Munich, Germany, and was found to have this virus. And then the outbreaks in the eastern province in Al-Hafuf, in a hospital there, involving over 20 patients, which has now fortunately come under control, and there's been no further patients identified in the eastern province of Saudi Arabia for several days, perhaps close to a week now. And again, UAE, there have been 2 patients total, one from Abu Dhabi who is transferred to a hospital in Munich, Germany, another just about a month ago from France who had visited Dubai and who returned home to France. So a central question, as Dr. Margaret Chan, the Director General of the World Health Organization, mentioned in her closing speech yesterday of the World Health Assembly, is how are people infected with this new virus? It's suspected but not proven that there are 1 or more animals or animal species, types of animals, that are reservoirs, if you will, that are infected with this virus and that infect people through close contact with people. But these hypothetical animal species that have this novel coronavirus have not yet been identified. With regard to the SARS coronavirus in 2003, it was found that there were one or more animal species that was infected with the SARS coronavirus, and from those animals, people were initially infected. But then the virus, the SARS virus, 2003, it changed its genetic composition, it mutated, and it became able to spread from person to person fairly easily. So that by the end of the SARS epidemic, there are approximately 8,000 people in 29 countries who had SARS, the infection, the disease, approximately 10% or 800 of whom died. So at this point today, with regard to the novel coronavirus in the Middle East causing the Middle East respiratory syndrome, or MERS, we're nowhere near the situation that developed in 2003 with SARS. Thank goodness, and hopefully it'll stay that way. Nevertheless, I think it's very, very important to find the animal source, if in fact there is one, of this new virus. However, of the 44 people that have been tested and have laboratory confirmation or proof of infection with this new virus, very few of them have reported any animal exposure. A small number, maybe 2, 3, 4, have reported exposure to camels. Maybe 2 have reported exposure to goats. But the great majority don't report any animal exposure. There's also concern that the virus might originally come from bats, and that bats infect some other animal, which then infects people. So work is going on primarily so far, to my knowledge, in Saudi Arabia in testing bats, camels, goats, cats, and other animals for this virus. And that information was presented last week, again, at the week-long annual 66th World Health Assembly in Geneva, presented by the Deputy Ministry of Health for Saudi Arabia, Dr. Ziad Memish, who oversees the response in the Saudi Arabia for this novel coronavirus causing the Middle East respiratory syndrome. There has been some person-to-person transmission of this virus, however. It's not clear whether the transmission occurs by having the virus on one's hands and touching someone else's hands or face or eyes or nose, or whether it's spread over a short distance through the air or in some other manner. It's simply not known, again, as Dr. Margaret Chan said yesterday in her speech in Geneva. However, there are multiple occasions, and I've listed them here, in 5 different countries where there has been some limited, very limited, person-to-person spread of this new virus. In Jordan, in the UK, in a family, a returning traveler to the UK, who transmitted the virus to 2 of his family members, one of whom died. In the hospital that I mentioned, Eastern Province in KSA, a patient who returned to France transmitted the virus to another patient who was sharing the same room with in the hospital in France, because this new contagious virus was not suspected to be causing his pneumonia and intestinal problems. And just very recently, I think only within the past week, there is a person who returned home from the Middle East to Tunisia, and unfortunately infected 2 of his family members, although fortunately they both recovered, although he passed away. So what needs to be done now? Well, there could be a very long list of things, but I emphasize only a few. We need to have better diagnostic tests to identify this virus and to tell who's infected and who's not, so that we can treat them most appropriately and protect other people from getting infected by persons who are ill with this virus. We need to develop better treatments, and I've been working with a senior physician here in Abu Dhabi at the Sheikh Khalifa Medical City and with a person in the Health Authority Abu Dhabi on a previous visit about a few weeks ago, and spoke with them again last night, and we'll meet with the doctor tomorrow to try to come up with new treatment methods or protocols for this virus. We need to determine how people become infected, whether it's from an animal, if so, what animal or animals, and how people are infected from other people. Again, as I mentioned, is it through physical contact, through hands? So again, the very important emphasis to good hand hygiene, to wash one's hands thoroughly and frequently, or is it spread through the air over short distances? And from having worked in SARS hospitals in Canada and visited hospitals in Guangzhou, China, and in Hong Kong during 2003, during the SARS epidemic, I think it's very important to apply the many lessons that were learned around the world, but especially in Asia and Toronto, Canada, from the SARS coronavirus epidemic of 2003, that again affected 8,000 people, caused 800 deaths, and large amounts of economic loss and economic damage to countries in Asia and Canada. So as far as learning lessons from SARS, again, there could be many slides and pages, but I only have one slide and 5 lessons. And they're listed here on this slide. First of all, I'd like to emphasize that outbreaks can spread very quickly in days to weeks. And again, that's what happened with the SARS epidemic that had been in Southeast China, and then late February of 2003 came to Hong Kong, and then people got on planes who had the virus, and they traveled to Singapore, to Hanoi, to Toronto, and elsewhere, and triggered outbreaks in different cities. Outbreaks within hospitals of a new virus in general, any new infectious disease, certainly the SARS coronavirus, are big red flag warning signs that this new virus is being able to transmit to other people. And so I pay particular attention to the outbreak in the hospital in Zarqa 13 months ago, and the hospital outbreak in eastern Saudi Arabia from April into early May this year. Communication with the public is essential, and I'll emphasize 5 principles of good communication about outbreaks, according to a World Health Organization document that was put together by experts after the SARS epidemic in 2003, and the guidelines were put out in 2004 by World Health Organization. International travel can mean international spread of the virus. We saw that again in SARS, as I mentioned, and we've seen it now, but on a very, very limited basis. So travelers to France, travelers to the UK, travelers to Tunisia, having this virus, and then transmitting it to 1 or 2 other people in those countries respectively. And again, controlling, but first identifying the animal source of this new virus is necessary, important, and imperative to controlling the virus and future outbreaks. The World Health Organization posted on their website 1 year after SARS 5 principles in a long document that I highly recommend to you, organized by Dr. Jolie Leonard and Dr. Peter Salmon and a large number of experts in Asia and Canada, on the best ways for authorities, whether it's political authorities or medical authorities or risk communication experts, how to communicate with the public during outbreaks of new infectious diseases. And these are the 5 principles that they emphasize, the 5 guidelines. You need to build trust with the people you're talking with and sharing information with. You need to announce new information early so rumors don't overtake reality. You need to be transparent. You need to respect the public's concerns and respond to them appropriately. And you need to plan in advance. And I'd say that's where we are now, planning in advance for what might never occur, but if it does, we need to be very well prepared for possible outbreaks of this new coronavirus causing the Middle East respiratory syndrome. Also during this past week in Geneva at the World Health Assembly, Dr. Keiji Fukuda from the World Health Organization, the WHO, who is the Assistant Director General, I believe is the point person, if you will, for this new virus in the Middle East. He gave a very nice slide presentation. In the next slide, I have basically just copied Dr. Fukuda's slide onto the next one that I'll show here. World Health Organization, WHO assessments and concerns with regard to this novel coronavirus causing MERS, or Middle East Respiratory Syndrome. There's a high concern over the potential, and Dr. Fukuda underlined the word potential as I've tried to emphasize here. There's no cause for alarm at this point. We're talking about potential or possible scenarios. So potential for sustainable person-to-person transmission and spread of this virus. So far, there's been no sustained spread. It's been to 1 person, maybe to 2 people, maybe to a small number, but it's not sustained, person to person to person to person to person. That hasn't happened. Countries in the global community are not adequately prepared, Dr. Fukuda said. Not prepared how? Not prepared in terms of adequate awareness, not prepared in terms of adequate surveillance, that is, looking out, testing, identifying this virus, whether it's in the animal domain or in people. Readiness for potential impact on health, health systems, communities, and economies. Again, remember the huge economic losses in 2003 in the 29 countries that were impacted by SARS, particularly in Asia and in Toronto, Canada. And Dr. Fukuda says we're not adequately prepared in terms of the most effective prevention, treatment, and public health control measures. And while that is true, in my opinion, the good news is now we have time to prepare. The outbreak is controlled in eastern Saudi Arabia. There's been no more cases anywhere else in the Middle East or outside of the Middle East. So now is the time of calmness, the time for us to work together to prepare. So the last 6 weeks, as was mentioned, I've had the really great honor to be able to travel to UAE, to Qatar, to Jordan, to talk with Dr. Ziad Memouche, the Deputy Minister of Health for Saudi Arabia, when he was in Geneva on cell phone, to travel to Egypt, where they also are very concerned about this new virus, even though they have not identified anyone yet with the virus. And so I decided on Sunday, May 19th, to write a letter to Dr. Fukuda at the World Health Organization and to colleagues in Geneva and at the Eastern Mediterranean Regional Office, EMRO, of the World Health Organization that has responsibility for the entire region, all the countries in the region, including the countries where the outbreak has been identified. In addition, basically I called for a regional meeting to be held here in the Middle East, but an international open meeting, so countries could come, for example, countries from UK, France, Tunisia, Germany that have been involved with the care of patients, to participate in an open, transparent manner and share all the knowledge that has been accumulated about this new virus and this new disease, how best to diagnose it, test for it, and to prevent it and to treat it. And similarly, on 2 days later, May 21st, I posted the same request on the website for the program for monitoring emerging diseases called ProMed. And the website you can see, it's just www.promedmail.org. And while I personally not received any direct reply from the World Health Organization, I am confident that there have been ongoing discussions this past week in Geneva during the World Health Organization annual meeting, the World Health Assembly, I should say, on the part of health ministers with regard to how to best share information, particularly very soon, in the coming weeks prior to Ramadan and certainly prior to the Hajj in October. And so here I'd like to stop to thank you very much for your interest. And again, in the discussion session, I'm very happy to answer any questions that you might have. So, shukran jazeera.